Hello, and welcome to another Arthritis Wellness Conversation. I'm Sandra Sova, and as always, I am joined by a research scientist from Arthritis Research Canada and members of the Arthritis Patient Advisory Board. On the panel today is Dr. Jackie Whittaker, and from the Patient Advisory Board, we are joined by Julia, Chris, Sheila, and Trish. Today's topic is targeted movement. Can it help me lead a better life with arthritis? Dr. Jackie Whittaker is Associate Professor at the Department of Physical Therapy at the University of British Columbia and Research Scientist of Musculoskeletal Rehabilitation for Arthritis Research Canada. And Jackie, if I understand correctly, your research centers primarily on looking at osteoarthritis.
Yeah, it centers on looking at osteoarthritis, but a big focus of what I look at is how to prevent osteoarthritis. And that fits very well with the topic today because it really comes down to physical activity and exercise therapy. And I have a feeling that those are a few of the topics that we're going to get at to today as we go through our conversation.
When you hear osteoarthritis, there is sometimes a misconception that it is a condition only of people that are of advanced age and the elderly. But your work actually is at the other end of the spectrum. Tell us a little bit about that.
Sure. Well, I think, first of all, thank you very much for having me today. I'm looking forward to this. One of the things that, when you look at the prevention of any disease, what we're seeing more and more in the research world is really trying to take a lifelong perspective at prevention. And people don't just, as you said, don't just get osteoarthritis when they're old. And if they do get it when they're older, it's often based on things that have happened to them earlier in life. So we, in particular, in my group, we focus on a form of osteoarthritis called post-traumatic osteoarthritis, which is the osteoarthritis that you get typically after you've had some sort of a joint injury. Most common joint injuries are knee injuries. The most common form of osteoarthritis is knee osteoarthritis. So we spend a lot of time in the knee. And we know that knee injuries are one of the most common injuries that happen in youth sport. So absolutely, I'm focused really early on in that lifespan. Kids have knee injuries. They have them, an astronomical number of them every year in our country. And a good chunk of them, about 50%, will go on to develop post-traumatic osteoarthritis. And what the research is actually showing us is that they can have signs of osteoarthritis, 5 to 10 to 15 years after their injury. So if, let's say, they tore their anterior cruciate ligament, which is an important ligament in the inside of the knee, they could, at the age of 18, they could have early signs of osteoarthritis by the age of 28. And as you said, most people typically think of osteoarthritis as something that their grandparents get, but the reality of it is we're seeing people get this disease earlier and earlier and earlier. And I think that represents some challenges, but I think it also represents some opportunities for raising awareness and being able to act on things much earlier in the lifespan.
Trish, you have an experience, I know, with an injury that led to your osteo. Is that correct?
Yes, I was 17 when I blew my knee out skiing, and I had 5 years later, I had reconstructive surgery on my knee at the age of 22. I was diagnosed with OA not until my 30s, but I do know that they said I had signs of OA earlier than that, but I think because my muscle strength was so strong, because I was an athlete, I didn't really start to have problems till I was pregnant. And in that last trimester and afterwards, post-pregnancy, I started to have a lot of knee pain and joint stiffness and a lot of problems. But before that, they're always saying, well, it could be my sports-related injury, that I could be, patellar femoral, or I could have other forms of knee problems because of the pain. So I wasn't really diagnosed until I was in my mid-30s, but the x-rays showed that I had it for quite a few years.
Regardless of the age of someone that has osteoarthritis, one of the really key factors is to make sure that there is movement, that that activity is continued. And from the questions posed to the panel prior to this session, I had asked whether people have avoided physical activity because of fear of either pain or injury. And a lot of people mentioned that there was a pain factor. Julia, you had mentioned that it wasn't so much a concern of pain, but more of not wanting to be injured.
Yes, that's correct. So I was a dancer for many, many years, and all types of dance, ballet, tap, swing, you name it, I've done it. And I guess I have built up quite a pain threshold, because always with dance, you get injured, you hurt your knees, you twist your ankles, your partner drops you, all sorts of things, right? So for me, it was never, I've always had a very high pain threshold. So for me, I was always able to just push through the pain of any injury. But now with, dealing with arthritis, I'm more concerned about injury than I am with pain. And I think I have a very difficult time still pulling back and not pushing myself too far, because I still have that mentality of, no, I can just push through it. I can just work through it. But then I realized, no, I'm not 20. So I can't really do that anymore. So I have to learn to sort of find the limit that works for me. Yeah.
That was something that came up quite a bit in the responses, is pacing yourself, knowing your limit, know what works. Jackie, I'd like you to talk to us a little bit about the fact that it actually is okay to feel and experience pain, discomfort while we're exercising.
Yeah, pain is a really interesting thing. And, I think most of us in Western culture, probably in any culture, we think of pain as a bad thing. It's kind of got this negative connotation. And I'm certainly not trying to spin it as a positive thing, but pain is actually a really natural, normal sensation that our body gives us that contains a lot of really useful information. So, the way that we're wired as human beings is that when we start to reach the limit of our tissues, prior to that happening, our brain will give us an experience of pain to say, hey, time to slow down, stop, take a break. And then if we do, we don't ever really come to the limit of our tissues and experience an injury or damage to the tissues. So pain isn't a sign of damage or a sign of injury. It's actually a warning sign that something potentially bad is about to happen. However, if you're in a situation like maybe Trish skiing down the hill, where there is something that happens quickly that you can't control, and you can't stop loading your tissues at that point where your brain's giving you the signal, you can really easily blow through that tissue limit and then have actual damage done to your tissues, like tear an ACL. And there's obviously pain associated with that. So it's tough, because I think most of our association with pain is it's bad. It means we've damaged tissue. That's not good. I should try to avoid that. But the reality of it is that if we can load our tissues slowly, and I guess I don't want to say methodically, but we can be really mindful of how we're loading our tissues and adding load. It's actually an insanely helpful sensation, because when we start to feel it, we get a sense of, oh, okay, you know what, that's kind of my limit for today. It's okay that I've hit the pain. I can maybe sustain this for a little bit with the pain. But if the pain starts to keep going up, okay, yeah, I've got to listen to the pain and I need to back off and take a break. So typically what we tell people is it's okay to experience pain when you exercise. And in fact, if I'm trying to teach somebody how much exercise is good, how much is too little and how much is too much, I'll often say to them, that sweet spot is when you actually start to feel a little bit of discomfort or pain, because you've actually pushed beyond what you need to get a positive adaptation, but you don't want to push too far into that pain because you don't want anything negative to happen. But just kind of that onset of pain isn't such a bad thing, because it means you've actually probably pushed things far enough to actually get an adaptation. But it's a real balance. And I think, as Julie's saying, it's something that we learn about our bodies over the years. And then when different things happen, when we age, when we stop doing a particular activity, maybe we're given a diagnosis of arthritis or something else, that relationship, that balance can get messed up, and then we've got to learn it all over again. So yeah, I don't know if I completely answered the question, but I like to really try to get people to think of pain in a more positive way, and that it really contains all this really useful bits of information that we can use.
Mm-hmm. I think that pretty much anyone that is living with a chronic condition such as arthritis, pain is something that that is something that we're familiar with. So one of the things that I found really interesting when I started to do my exercise program is that even though there would be pain and discomfort afterwards, I would have pain relief because I would have more range of motion. I would have more, like I say, I go to the gym and I painfully limp down those 14 stairs. And yes, I know there are 14. And then when I come home, I'm boom, boom, it's much different. So Chris, I know that you do a lot, you're quite active and finding that balance with exercise. Tell a little bit about your experience.
Oh, I definitely have that same fear of pain going into exercise, and I had a host of sport-related injuries before I was ever diagnosed with arthritis. And then when I did receive the diagnosis, when I was going through my initial severe bout of arthritis, a lot of those same areas flared up. So I definitely had the fear of those areas becoming injured again. But I definitely go through that same cycle where I'll receive some pain. I'll feel some pain when I'm getting into my run. But one of the primary reasons I run and cycle is because it feels so good afterwards. It's the runner's high, and it's a great medication on its own for pain relief.
I might just add in, there is a plethora of research to show that the most effective thing that you can do to reduce arthritis pain is exercise. It's more effective than medications, pain medications, etc. And I don't think we think of exercise as a pain prescription, but it's an awesome pain prescription. But it doesn't mean, like you said, Sandra, that it doesn't maybe you don't start feeling the pain, but it's kind of knowing it's okay to work through it to get to that point where you get the relief. And I think for a lot of people that have a new diagnosis or have had past injuries, there's a fear or a worry that when they first start feeling the pain, that it means a whole bunch of other different things. And I think people just have to have education that it's okay. They've got to know how to pace. They need somebody to throw ideas around or talk things out with as they're figuring it out. And also not be scared to get it wrong sometimes, because you know what, you might get it wrong. You might have a bit of a flare up, but then next time you might figure it out better. And so there's kind of that, trying things out and finding out what's best for you.
So along the lines of trying things out and figuring it out, I asked the question, did anyone seek the services or guidance of physiotherapist prior to embarking on an exercise program? And everyone on the panel had some experience with that. Sheila, I know that you also worked in the physiotherapy field previously.
Yes, in the 1970s and the 1980s. That's a really long time ago. I tore my anterior cruciate ligament when I was 13. Oh. That's more than 50 years ago. And I've lived without an ACL. There were no MRIs or repairs or anything at that time. So that whole time I've had no ACL. And I use exercise as my main mode of treatment. I take very few NSAIDs, almost never. Only if I have a flare. It's always exercise is my first go-to thing. But I am careful what kind of exercise I do. So I don't do any rotation sports, for example, because like tennis or pickleball or badminton, those types of things where there's a lot of rotation because of the instability in my knee. But I am an avid bike rider, and over the years I've gone to an e-bike because I can control my joint load using an e-bike. A lot of walking. I live on the side of a mountain, so over the years I used to do a lot of climbing, and now it's more less climbing, flatter walks, easier terrain. So the thing is to always continue to adapt. So actually my knees gave me very little pain, and I just use basically exercise, appropriate exercise, load duration technique to keep in shape.
How valid is it to seek out some professional advice before starting like weight training or anything from a physiotherapist if you have arthritis?
I think it's a really personal question. And I think that, everyone comes to the journey they have with arthritis with different knowledge and skill. And if you come to that journey with a lot of background knowledge about your body, about loading your body, about exercising, you may or may not need help. But if you don't, there may be some value in finding somebody that can give you the information you need so that you've got, I guess, what we call kind of realistic expectations. That you maybe interpret the sensations in a more accurate way, or at least question maybe how you're interpreting them, and then maybe help you figure out how to get the most out of exercise. What is the most appropriate exercises for you? Yeah, you might want to target a specific muscle. One person might target it one way, that might not work for you. You might need an alternative. So I think if you start to run into little barriers, I always say to people, you don't wait until you're not exercising and you've been inactive for 2 years to seek help. If you're in the process of trial and error and you can't seem to figure it out, that's when you actually want to seek help. Don't get down on yourself and think, oh, I should be able to figure this out on my own. It's okay to ask for some help, figure it out, and then you can take all that motivation and ambition that you have and just apply it to going forward and exercising. So I think it is very variable. I also think another really important piece is when you go to see a physio, or if it's not a physio, you seek help from some other medical practitioner. I think it's really important up front to say exactly what you want from them. I think sometimes people's experiences, the interpretation of what the healthcare provider has that they need to provide and what the person who's got the questions wants sometimes don't jive. And so I do really think it's important to say, hey, you know what, this is what I want to achieve. These are my exercise goals. I've tried these things, it's working, or this isn't working. Have you got any suggestions that might be able to help me move forward in my program?
Mm-hmm. Absolutely. Having that dialogue and having that conversation is so important. When it comes to physical activity and working with arthritis, what are some of the activities that those on the panel find are a good fit? What sort of things do you enjoy doing?
I think for me is I've had to try a variety of different exercises, and some days one works really well and other days it's not. So I try to find a balance of, deep water running. I sometimes will get out there and walk and stuff. And then I also do my stretches and some of my other activities that I do with the exercise ball or the peddler. I haven't been able to get back on a bike since I've had my knee replacement, but I can pedal the peddler, which is a stationary sit thing when you're sitting in a chair and using that, so it's not up on a bike, where I'm in a different body position. So I think when you find what exercises work for you, and you also have to find out the duration or the length of time or the intensity, because some days my arthritis is better controlled and I can push myself a bit more. So I find there's a balance. So I usually do the pool pre-COVID 2 times a week, walking 3 or 4 times a week, and then my other stretches and my other ball exercises and stuff on the other days, or sometimes on the same days, just to keep those going. But I'm actually had to give up competitive badminton and had to give up skiing and golfing and a few other things. So I'm trying to find other things that my body can do.
Wish I was going to say the same thing about swimming. I was in a good routine pre-COVID, but now it's really hard. But it's such a great low impact activity and something that you could still push yourself and get a good workout from. And the other one I wanted to mention was weight training, which I've really gotten into because that can be low impact as well. And it's something I feel like I really benefited from because by being able to build up strength, I feel like I'm protecting my joints and a little safer from injury.
Yeah, for me, yoga is my big go-to, and I actually do have a couple of light hand weights that I will use while I'm doing my yoga routine. So I'll use that for the arm strength and the wrist strength and the hand strength. I'm also a swimmer. I tend to swim in the summers because we have an outdoor pool here in my complex. But the winters, I kind of resort to doing a little bit of a stepping program at home with the weights. And definitely I walk everywhere. And we just, my husband and I just got our bikes back on the road again. We just got everything tuned up. So right now I'm very slowly rebuilding the strength in my legs for biking, which is not something my legs are used to. But yeah, yoga is my it's the one I love the best because it keeps my flexibility. And I think there is, I don't know if people often realize it, but there is strength building in yoga. In certain poses, you're holding up the weight of your own body, and and so for me there's that strength training and the flexibility in there.
For me, my go-to is bike riding, outside bike riding with an e-bike, as I mentioned, but inside in the winter, my stationary bike is in front of my television. So when I'm binging on Netflix, I'm actually on my bike, which kind of mitigates some of that sedentary behavior. And I enjoy restorative yoga. I find that really beneficial. And also, when the pool was open, I would go there occasionally, although it's not my main thing that I do is walk, a lot of walking in various terrain. Walk with a friend. The motivation for me often is to have somebody else to walk with, so that you're doing it on a regular basis, standing dates with certain friends to get out there and make sure that you actually do it to reinforce that behavior, especially when the weather's bad, because they'll prod you when you don't want to prod yourself. So
That's right.
yeah, and a variety of things. I also am a kayaker, so a lot of kayaking.
Nice.
Kilometers on the coast over the years. It's a fantastic place.
Well, congratulations to all of us for being active. For myself, I go to the gym every other day, so that's what I love to do. And I think this is a really good example of how individual and unique we can make these exercise programs. And it's the movement. And it's, Jackie, I'd like to circle back and have you talk to us a little bit about just how important that physical activity is, and also the importance that, if need be, to look at weight management.
Yeah, it's interesting. I always think of exercise as a very broad term, and there's kind of this piece around physical activity and this piece, and I can't help it, I'm a physiotherapist, but this piece that has more of a therapeutic goal, which you could call therapeutic exercises or exercise therapy. So if you're living with arthritis or knee arthritis or RA, you're going to have sort of therapeutic goals around, as some of you guys have said, maintaining strength around these joints or flexibility around these joints. So you're doing the exercise for a benefit beyond just, looking after your physiology, reducing your risk of cardiovascular disease and obesity and all the kind of comorbidities that happen with that. So I think it's really important that everybody, regardless of whether they're in a wheelchair or they have rheumatoid arthritis or they've had an ACL tear or they have multiple sclerosis or anything, get their 150 minutes or 180 minutes of moderate to vigorous physical activity every week, because that's what we need to just be healthy as human beings. But then there's this other piece around, I want to stay strong. I want to keep my bone density. I want to keep my, my balance. I want to keep my flexibility. And I think that it sounds like everybody here has sort of picked, different or identified different types of exercises that, number one, they love to do, and number two, work for them. Because those are actually the most important things. If you're not, we always say that the most important exercise is the one you do. It doesn't matter what anyone else says. They can tell you this is the best thing in the world, but it doesn't matter if you're not interested in doing it. So I think there's benefits to both forms of exercise, if that makes sense. The one thing I want to bring up, and only because, Chris, you talked about low impact, and I think impact is such an interesting thing, because don't get me wrong, I do think there's times when you're having a flare up where you do have to balance or pace joint impact. So I want to just kind of say that before I go down the road that I'm saying. But one of the most important things to understand is that the human body and the tissues of the human body, they adapt to how they're loaded. And so if you don't load a tissue, it won't adapt. If you guys know this, if you sit on your couch and you don't do anything, your muscles start to disappear. Your cartilage starts to get thinner. Other things start to get bigger. I mean, it basically, we get better at what we do as human beings. And if we do things that load our tissues get better at handling load. If we don't load our tissues, they're not so good at handling load. And so I agree that you have to really balance and pace the impact activities, but particularly in the context of osteoarthritis, and I'll maybe even go down kind of upstream a little bit more and talk more about preventing osteoarthritis. Impact exercises are actually incredibly important because the way that the cartilage in our joints gets its nutrition is from the fluid that's contained in the joint, not through blood supply. And the only way that that fluid can get in and out of the cartilage is when the cartilage is squeezed and released, because that allows for the fluid to move in and out, sort of like a sponge. When you squeeze it, the fluid moves out. When you release it, the fluid moves in. And the way that we naturally get this squeezing and releasing happening is by actually walking, jumping, squatting, loading. And so I think that that's an important thing to remember, because I think so many people with arthritis or who've had a joint injury will say to me, oh, I thought that I wasn't supposed to do impact activities because that was going to make my arthritis worse. And I kind of loop back around them and say, well, actually, by avoiding those activities and starving your cartilage of the food that it needs, that may not necessarily be the best strategy either. But I do think that in the context of RA and other forms of arthritis, the impact thing becomes a little more tricky to control, because if you're in a flare-up or your meds aren't controlling things really well, then it's not quite as simple as that. So, but I just wanted to loop around to that, and just curious if anyone's got anything they want to say around the impact thing, because I think it's a really important conversation for people with arthritis.
Well, it's good news to me, Jackie, because I love to swim and cycle, and I used to be a runner, and I've been trying pretty hard to get back into it and ease back into it, and I've been second guessing myself if I should be trying that or not. And
I think it's okay to try it, but pace yourself, build up your tolerance slowly, do some walk, run stuff, let your body adapt. That's the other thing is, our tissues adapt, but they don't adapt overnight, right? You got to kind of load and then they adapt, and then you load a little bit more and then they adapt. So I think it's just really listening to your body. That's a key thing. And you know what? There's nothing wrong with swimming and water exercises. They have a role to play, but it may not be the role in feeding the cartilage of the joint. So you just want to do a little bit of all of that, I guess.
That's why I think walking makes such a great exercise, is because it is a good loading activity. You need no equipment, pair of shoes, a rain jacket these days, and just get out there and do it. And it's so simple. And you can start with a short walk and work your way up from there. You can change where you go, change who you go with. You add varieties, going on trails, having urban walks, or even mall walks in non-COVID time or whatever. So there's a whole lot of variety and very little barrier, except you making a commitment to do it. And it's a high impact, especially if you walk at speed, and good cardio in the moderate cardio range if you walk at speed as well. So it's to me, it's a go-to preferred way of having my joints stay healthy, and having all of me stay healthy, because I tend to socialize when I walk.
Yeah, pre-COVID, I was doing still a little, I wasn't doing the type of dance that I did years ago, but my husband and I would go and do ballroom dance classes together. And I choreographed a pantomime with a bunch of kids. So for me, that was a lot of fun, because I had to create the dance, choreograph it, show it to them, and then have them do it. Since the pandemic has come along, there hasn't been any of those dance classes, but every once in a while, just for fun, I might choreograph a little 3-minute something in my living room, just because I miss it and I can do it. So why not? And it's fun. So
I think for me, I'm going to follow up a little bit with what Sheila said, is I have balance issues. So I actually do use equipment. I use walking poles, and I find I get a better cardio workout with my walking poles. When I'm walking without the poles, I tend to walk slower. I'm a little bit more tentative maybe. And I think this is because I've had osteoarthritis for over 30 years. So you kind of have that adaptation in your brain because you're trying to protect yourself. So I find the poles are actually very good for me. I do get a better cardio, and I do walk a little faster. I think it just gives me a little more confidence. And the other part of walking with a friend, I found sometimes it's easy to bail on myself, but when I have a partner or a friend or somebody I'm walking with, I'm accountable. So I think that actually helps me personally, is having somebody to walk with. And this summer, especially with COVID, we've actually Googled trails or parks and things that are in our area that we've never ever been to. And I like the variety. I like something to look forward to. So sometimes, you know, when you're living with a chronic disease like arthritis, sometimes the mental side of living with the disease is just as important as the physical side. So I think those things is the walking poles, finding the trails, and having somebody that I walk with that I'm accountable to. So those are some of the things I use to keep moving, keep going.
I love
always
that.
remember that thing years ago is move it or lose it.
Move it or lose it. Yeah.
Yeah.
I feel this is such an important conversation to have and for people to hear, because it's never too late to start in with an exercise program. It's never too early to start in with prevention, but I'm so inspired and encouraged to get this message out. I want people to believe that it is possible, that even if you do have pain or mobility issues, start slowly and find something that works. And it is such a benefit to your life. Jackie, I did want to ask you, what do you know about how can we sort of repair? Let's say we have an osteoarthritic joint that we're considering knee replacement. Can targeted movement reverse by feeding that cartilage? Can we gain back function?
You know, you raise a really interesting point, and I guess it depends on how you define osteoarthritis. So, you know, typically we talk about the disease of osteoarthritis, which is those degenerative changes that we see in the cartilage and the tissues associated with the cartilage. But actually, the burden of osteoarthritis on us individually and society is due to the illness, which is the pain, the loss of function, the inactivity, the early retirement, the healthcare costs, etc. So when I think about preventing or reversing osteoarthritis, and I guess the other thing I would say is there's really no association between the severity of those structural changes, those degenerative changes, and your functional level and your pain. So you can have people that have horrible looking x-rays that have very little pain and are actually very functional. You can also have people whose x-rays, have mild changes, but they're in a lot of pain. It's really impacted their function, and perhaps they're heading towards early retirement. So when I think about reversing osteoarthritis or reducing the burden on me of the disease, because I do have a little bit of OA in my right hip, for me, it's about less pain, more function, because if I'm functional and I don't have a pain, I don't really care what the cartilage looks like in my joint, because I'm not going to go seek healthcare. I'm not going to change my behaviors. I'm not going to go get surgery. I'm not going to take pain medication because I'm not really having a problem. So to answer your question, can exercise reverse those degenerative changes in the cartilage? I don't think we have evidence to suggest that that's the case. I don't think we have any evidence to suggest that there's a magic injection yet of anything, whether it be stem cells or any medication that reverses those degenerative changes. But what we can do, anybody with osteoarthritis can do, and I would say with people with other forms of arthritis as well, is that you can reverse or control your functional levels and your pain levels by staying active. And so I'm not sure if that's exactly the answer you want to hear, but I like to say it in that way because there's actually a really hopeful message there, which is you don't have to have pain. You don't have to lack function. Yeah, you might have to adapt it. Maybe you can't do that thing you love when you were 12 as much as you can do now, or maybe you have to do it in a different way. But you can actually reverse the effect that your disease has on your lifestyle. And I think that's the hopeful message that I would want to leave people with.
Mm-hmm. Really good. I would like to thank everyone for joining us today for another Arthritis Wellness Conversation. We hope that you have found this information valuable and inspiring in some way, and we will see you next time. For more information and to watch additional Arthritis Wellness Conversations, head over to arthritisresearch.ca.